The pursuit of rapid weight loss in Kenya has led to a surge in the off-label use of semaglutide, a medication originally approved for type 2 diabetes. Despite being prescription-only, medication Ozempic is reportedly available over the counter in some Nairobi pharmacies. Investigations have revealed that the drug is sold without proper medical oversight, raising significant health and regulatory concerns. Semaglutide, a prescription anti-diabetic medication used for the treatment of type 2 diabetes. It is prescribed to help people manage their blood sugar, but is now in use to help people lose weight. It is injected into the stomach, thigh, or arm once a week.
It's like a hormone, like insulin. Because even insulin, you know, if people have diabetes and they are being treated with insulin, they have to be given an injection. And semaglutide is actually the standard way we use it for weight, is as an injection form, because it is like a protein. One of the things it does is that it increases satiety. Unasikia umeshiba. When you are actually now in front of the food, when you are feeding, it causes the stomach to have fullness. And that sensation of fullness tells you not to feed. But more important, it acts in the brain. Because in the brain you are told, hey, you don't need to take any more food, the appetite goes down.
The semaglutide craze gained traction in Hollywood, where image is everything, with some celebrities opening up about using semaglutide injections to lose weight. The semaglutide craze has permeated the Kenyan society, with increased demand from Kenyans seeking rapid weight loss solutions despite the high cost of the drug.
The cost for it, I can tell you, was coming to the prescription was 120,000 a month. But fortunately, these generic companies, they have a drug we call semaglutide. They are generic. We are using it quite often because that one per month is costing about 30,000.
Persons using this drug have reported losing up to 7 kgs monthly.
They may cause nausea, vomiting. They may find you are not, you may get, some people even get constipation.
This is what experts advise persons who do not have diabetes type 2 but use the drug to lose weight.
For weight management, it is when the BMI is 30 and above. And they know the BMI calculated is very simple. Your BMI is weight in kilos divided by height in meters squared. And somebody who has a BMI of 30 and above is one where you can use semaglutide when you're only focusing on the weight. But those other people who may have now other cardiovascular risk factors, like somebody who has high blood pressure, somebody who has high cholesterol, people like those ones with chronic kidney disease, any insult to the kidney gives you a risk for damage to the blood vessels. So if you have any of those, we call them major cardiovascular risk factors: hypertension, diabetes, people who are physically inactive, people who have high cholesterol, and people who may have had blockages of the blood vessels, either by a stroke or a heart attack. We say that those ones now, you can use semaglutide when your BMI is more than 27.
While the results may be visible within a month, medical experts are warning against the misuse of this drug.
We usually start a dose of 0.25 milligrams weekly, every week as an injection. Then after a month, you go to 0.5. And you go increasing it. And the studies which were done on the drug was going to a maximum of 2.4. But of course, we don't want people to just misuse them, that you just want to become, you know, the people who like modeling, just want to be nice. It's midstream. That's not for that. They are meant to be done with a prescription. You need people to encourage about exercise, because you just take a lot of food, because probably you have other areas making you have need for taking a lot of food. Then you find you may just be wasting the muscles, and then that muscle wasting has its own problems. And so it should be something where you are done by somebody with the competence to prescribe it, not over the counter.
There are also risks of long-term complications associated with using semaglutide for weight loss.
Actually, the main problem with the semaglutide use is if you're using it and you're not exercising, because you lose muscles. And when you also stop, because at times you have to stop, people cannot continue using it. Sometimes they have reached the target weight. When we look at that person who has lost the weight, if they are not exercising regularly, then they have lost a lot of muscle. And that loss of muscle, of course, will make your other metabolic problems of the body come in. And then when the weight is now regained after stopping, you tend to regain the fat only, and the muscles don't come back.
Semaglutides cannot be used on pregnant mothers, breastfeeding mothers, and children. Drastic weight loss also leads to an aging effect.
When there's drastic weight loss, people look very old, because when you don't have that fat padding the skin, then you look very old. Because, of course, when the body adapts, the skin fits with the fat is available. When this disappears, you start sagging. But the way to win it, as I said, is that when you are losing the weight, you tend to also lose the muscles if you're not exercising. So you maintain regular exercise, and the diet also being also part of it, then that can be overcome.
Ultimately, medically supervised weight management programs that combine nutrition, physical activity, and psychological support remain the safest and most effective path forward.